Hello everyone, you're watching PhysioClassroom channel, and in this video of soft tissue treatment technique, we are going to learn yet another manual therapy skill that can be utilized by the physiotherapist to treat upper and lower back pain patients. The technique that we are going to learn in this video is known as the bilateral thumb pressure technique, and again the indications and the contraindications remains the same as were mentioned in the previous videos. So let's get started with the practical demonstration of the bilateral thumb pressure technique. So to perform this technique, the therapist makes the patient lie down in the prone position and the therapist stands on the head end of the table. The therapist is going to utilize both the thumbs to deliver the bilateral thumb pressure technique. And first, the therapist is going to start by treating the musculature overlying the T1 transverse process. So the thumbs are going to be placed on the soft tissues overlying the transverse process of the T1 vertebra, whereas the fingers are going to fan out in the lateral or the outward direction. The therapist is going to take a stance position and is then going to engage the soft tissues by giving a ventral force. Next, the soft tissues are going to be stretched out in the inferior and lateral direction so that they are taken to their elastic limit of patient's tolerance. The position is held for 4 to 5 seconds before returning back to the neutral position. So let's again observe the technique in the close-up view. The thumbs of the therapist are going to engage the soft tissues first in the anterior direction so that I am applying a direct anterior force utilizing the weight shift from back to front leg. Now the therapist is going to engage the soft tissues in the inferior direction and finally in the lateral direction. Remember that the thumbs should not slide over the skin as this can result in irritation. So I am engaging anteriorly, inferiorly and laterally. This position is held for 4 to 5 seconds before returning back to the starting position. Now in the same manner, the therapist can reposition the hands or the thumbs overlying the transverse process so as to treat the whole of the thoracic spine from T1 to T12 spine. The treatment can next be progressed by the therapist now standing towards the pelvis side and now positioning the hand in this manner. So this time I am starting by treating the soft tissues overlying the T12 transverse process. I am again going to perform the same technique, engaging the soft tissues anteriorly, superiorly this time and outwards. And so in this manner I can keep on treating the thoracic spine now from T12 to T1 region. Now physiotherapists can also utilize the bilateral thumb pressure technique in the same manner to treat the myofascial tissues of the lumbar spine, which because of tightness can result in lumbar spasms. So this was all about the practical demonstration of bilateral thumb pressure technique. See you all in our next video. Till then, keep learning, keep sharing and stay connected.